In this video, we will demonstrate how to provide IV options to the user by enabling them in the Scenario Builder. In the Scenario Builder, select the IV tab and toggle the IV options on. Choose the number of IV bags that the user will be able to attach to the patient. There can be a maximum of 3 bags infusing during the simulation. Select the method of controlling the IV fluids that will be available to the user. The IV can be controlled by a drip set or by an IV pump. If the drip set is turned on, select the options you would like to be available to users in the simulation. Set a range for drops per minute, as well as the drip sets to be available. If the IV pump is selected, there are other choices. The scenario author may select to allow titration of the IV, and if secondary lines will be allowed. Both drip set and IV pump options can be enabled in a scenario. This allows the user to select the control they want to use within the simulation. Under the Types and Placement heading, select either peripheral or intraosseous. A selection of available sites may be made available. The scenario author may choose to allow the same options on each side of the body. For peripheral IVs, a selection of needle gauges can be made available. For intraosseous IVs, a selection of needle sets can be made available for the user to choose from. Scenario authors can allow the option of creating the IV access by saline lock. And for peripheral IVs, allow the option for 2 ports per site. The options made available by the scenario author are depicted on the paper doll. IV fluid options can be selected from the Medication Fluids tab. Select the fluid list, then choose the fluids that will be available in the simulation. Each fluid will come with recommended dosing and bag volumes. Dosing and bag volume options may be added or deleted by the scenario author. Additional fluids can be added to a scenario. Once added, they can also be deleted. The case author can start a scenario with an IV in place by selecting the On at Start button. Select the type of IV that will be infusing when the scenario begins. There are options available here for the scenario author: PICC line, portacath, and dialysis catheter that cannot be initiated by the user during the simulation. Select the number of ports for the site, the location of the IV, the side of body, and the needle gauge. Then select the fluid or medication that will be infusing, the size of the bag, the site where the bag is connected, and to which port, if multiple ports are available. Select the controls used for the infusion. Using the drip set, select a rate and the drip set to be utilized. Using the IV pump, select a function, either set rate, formulary selection, or custom dose. When the set rate function is selected, this requires 2 fields to be entered. Enter the volume to be infused and the rate of infusion. The platform will calculate the time for the infusion to be completed. Fill in the volume to be infused and the time to infuse. The platform will calculate the rate. Enter the rate and the time. The platform will calculate the volume to be infused. An error may occur if the bag selected is not large enough. When the formulary selection is selected, choose from the dosing available and choose a patient weight. The platform will enter the rate and time of administration. When custom dose is selected, enter a patient weight, a dose and dosing unit of measurement. Then enter either the volume to be infused or the time. The platform will calculate the remaining value. The scenario author can set a time that the infusion has been running when the scenario begins. Thank you for watching this VR Patients video.